now, I am going to perform the prenatal care and Leopold'S maneuver. So, first we need the equipments. Here, we have the tape measure, mother baby book, and tetanus toxoid vaccine, and also the 3cc syringe. So first, identify the client and explain the procedure. To prevent errors, this enhancing client to be cooperative and fan his confidence. So, good morning, ma'am. May I know po, please state your complete name.
Mandy Jane M. Sawit po.
So, ilan na po yung edad niyo, ma'am?
28 years old po.
How are you feeling today po?
Okay lang po.
Hindi po ba kayo kinakabahan?
Hindi naman po. Excited.
Excited. So, number 2, assess client's health history, which includes personal, family, social, previous obstetrical and present obstetrical data. Rationale, information gathered by healthcare provider will help establish baseline data, identify teaching needs. So, ma'am, pang ilang baby niyo na po ito?
Second baby po.
Second baby. So, ilan na po yung edad ng first baby po?
Ano po kasi siya, miscarriage, so nahulugan po ako.
Sorry to hear that po, ma'am. So, ask ko lang po if meron ka pong past illnesses or family or genetic illnesses po.
Yung mother ko po, meron po siyang hypertension po.
So, na-inherit niyo na lang po.
Yes po.
So, sa environment niyo po, how is your environment? Is it good? May naninigarilyo ba? May nag-take ng alcohol?
May meron pong nag-take ng alcohol, pero sa kapitbahay ko naman po.
So, hindi siya nag-affect sa inyo, ma'am?
Hindi naman po.
Okay, good to know po. So next, assess the client's knowledge on guidelines for health pregnant and antepartum care. Provide baseline data to identify teaching needs. Serves as baseline data for succeeding prenatal care. So ma'am, meron po ba kayong tinitake na vitamins na inireseta ni doc sa inyo?
Meron po, yung folic acid po.
Okay po. So number 4, review the plans for antepartum care visits, examination, and laboratory findings. Rationale, to serve as a baseline data for succeeding prenatal care. Number 5, monitor vital signs of the client. Rationale, provide a baseline data or future comparison and identification of factors that may place the client at risk for problems. So, ngayon ma'am, since meron po kayong inherited na hypertension, so I will check your BP po. Okay lang po ba sa inyo, ma'am?
Okay.
Open na po ako. Papisang po. So, ang BP niyo po, ma'am, is 110/70, which is normal naman po, and wala po kayong high blood. Six, measure the height on initial visit and monitor the weight in succeeding visit. Rationale, weighing is an important part of each prenatal examination. A gain or decrease in weight will affect pregnancy. So, we will assume na na-take na po natin yung weight and height ni client. Number 7, conduct physical examination. Begin assessing from head to toe. Rationally, to come with a general impression of woman's health and well-being. So we will also assume na na-take na po natin yon. Then next is we will perform abdominal examination. Instruct the client to empty or void her bladder rationally to promote comfort on the part of the client. So, ma'am, hindi po ba kayo naiihi ngayon? Pwede po kayong umihi na muna before po natin ipa-perform yung Leopold's maneuver.
Nakaihi na po ako kanina.
Okay po. Number 9, position the client in dorsal recumbent. Rationally, proper positioning relaxes both mother and baby. It also facilitates the easy location, presentation, and lie of the fetus. So, ma'am, i-ano ko lang po na kayo sa comfortable position niyo po. So, iaangat ko lang po yung paa niyo. Okay lang po ba? Then, bend. Thank you. So, next, drape the client and expose the abdomen from the level of the xiphoid process down to the symphysis pubis, rationally to provide privacy. Next, measure the fundic height using tape measure starting at 0 cm, rationally to determine the gestation and growth of the fetus. So, 34. Next, the centimeter side of the tape measure must be facing the abdomen while the inch side is facing the examiner, rationally to prevent bias. Next, locate the highest point of the fundus, leave one hand in place, and secure the end of the tape measure to the fundus. Measure down to the top of the symphysis pubis, rationally to measure the fundic height correctly. Next, document the measurement in centimeter, rationally to compare with the calculated gestation. Next, perform the Leopold'S maneuver, rationally to assess the condition and fetal presentation. So, ma'am, ipo-perform ko na po ang Leopold'S maneuver. Okay lang po ba sa inyo?
Opo, okay lang po.
Next, warm two hands by rubbing one against the other before placing them on the abdomen. Rationally, the use of warm hands during the palpation prevents tension and hardening of the abdominal muscles, favoring good results. Next, perform the 4 maneuvers. During the first 3 maneuvers, the examiner stands at the side of the client, bed, and faces the client. The position favors accurate performance of the maneuvers. Okay, so we will start for the first maneuvers. So first is the fundal grip with both hands, palpate upper abdomen and fundus. For A consistency, head is round, hard, breech is well defined. B mobility, so head moves independently, breech less mobile, rationally to determine the fetal part lying in the fundus. The second maneuver, which is the umbilical grip, so A, with both hands moving down, palpate the sides of the uterus from the top to bottom. One side smooth, hard, resistant surface, back. other side, angular modulation, knee and elbow, rationally to determine the fetal back for fetal heart tone, usually found in the left lower quadrant. So, let's proceed to the third maneuver, which is the Paulick's grip. So, with the right hand over the symphysis, identify the presenting part by grasping the lower abdomen with thumb and fingers. So assess whether the presenting part is engaged in the pelvis. If head is engaged, it will not move. If it is soft, it is in the back. So rationally, to determine engagement of the presenting part. So lastly is the fourth maneuver, which is the pelvic grip. So the nurse alters position by turning toward the patient's feet with both hands. So assesses the descent of the presenting part by locating the cephalic prominence of brow. So place your fingers with both sides of uterus about 2 inches above the inguinal ligament. Press downwards and inwards. See, if the fetal back is palpated, it means no obstruction. Then the other hand will meet obstruction, the fetal brow is palpated. So to determine the degree of flexion of the fetal hair. So next, reposition the client rationally to make the client feel comfortable. So ma'am, ibabalik ko na po sa kaninang position yung paa niyo po. Dahan-dahan lang po. Next, administer the TT, which is the tetanus toxoid vaccine, following the recommended schedule. So we have the tetanus toxoid 1, which gives as early as possible. So this is the first tetanus toxoid. So ibibigay talaga siya ng first. So next is tetanus toxoid 2, which is after a month later of tetanus toxoid 1. Next is the tetanus toxoid 3, which is at least 6 months later, and the tetanus toxoid 4 at least once a year later, and then tetanus toxoid 5 at about 1 year later after tetanus toxoid 4. So rationally, this is to prevent both the mother and newborn from tetanus. Next, administered iron folate supplement until the 2nd month postpartum. Rationally, to regain iron loss during childbirth. So, after niyo po mga anak, ma'am, mag-take po tayo ng iron folate po and also sa prescription ni Doc po, ma'am, ha?
Okay po.
Sige po. Next, administer malaria prophylaxis to all pregnant women in endemic areas as ordered by the doctor. So, give 2 tablets of chloroquine phosphate, 250 milligram, every week for the duration of pregnancy. So rationally, women are most likely to develop malaria when pregnant. Malaria can cause miscarriages, premature labor, small babies, and stillbirth. Next, provide and promote health teachings on good nutrition, personal hygiene, and enough rest and sleep. Rationally, to ensure an optimum environment for health growth and development. So ma'am, since sinabi niyo po kanina sa pagtanong ko sa inyo na meron pong nag-take ng alcohol sa environment niyo, which is nakakasagabal din po minsan sa ininyo nila. So, pwede naman pong pakiusapan natin sila na huwag masyadong maingay kasi it will irritate you po, ma'am, and will cause you stress, ma'am. So,
Okay.
bawal po yun. Ma-stress ang magkaka-bleeding po tayo niyan.
Apo.
So, yan. And also, sa nutrition niyo, ma'am, mag-eat po kayo ng proper diet na sinabi ni doctor. Kung ano yung proper diet, kung solid food ba, solid diet po ba ito, liquid diet, or high in fiber diet. Sundin lang po natin yung prescription ni doc.
Okay po.
And also the nutritionist po, ma'am. So, huwag lang po matigas yung ulo natin.
Okay po.
Sige po. The next, discuss with the client her expectations about pregnancy, which includes the danger signs of pregnancy, labor, delivery, and impact on the family. So, rationally, psychological assessment is important to assist the client in identifying areas of need to ensure the optimal fetal growth and development. So, ma'am, ano po ba yung mga inaasahan niyo mangyari since this is your second baby? So, di ba po, sabi niyo is nahulugan po kayo. So, what are your expectations this pregnancy?
Ano po, na-excite po ako and then sana hindi na maulit yun kasi matagal po na namin itong hinintay po.
Okay po. So, yan po. Next is plan with the mother the preparation for breastfeeding the baby. Rationally, to know the advantages of breastfeeding to newborn. So, ma'am, later on, i-discuss ko po sa inyo ang proper breastfeeding po and how to promote bonding with your newborn baby para mas mapadali yung pag-adopt ng pag-breastfeed po sa baby ninyo. And also po, malaki po talaga yung benefits ng pag-breastfeeding kaysa sa formula po.
Okay.
The next, discuss the importance of prenatal and subsequent visits, rationally, for follow-up checkups. So, ma'am, panatilihin po natin na maging consistent sa pag-prenatal check-up and also pag after nyo magka-baby, after lumabas ni baby, sa postnatal care po. Okay po ba sa inyo yan, ma'am?
Okay po.
So, that will be all. Thank you.